This episode of Beauty and the Surgeon podcast is brought to you by Let's Get Checked. Let's Get Checked is an online company dedicated to making professional health testing easy and accessible. Let's Get Checked offers fast, affordable, completely confidential at-home health tests from a range of tests from STDs, male and female hormones, and even COVID-19. Listeners of our podcast who are new to Let's Get Checked get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com, trylgc.com/beauty, BEAUTY, and be sure to use the code BEAUTY20, BEAUTY20 at checkout. Do it. Getting tested is important. It's the responsible thing to do, and you know how important I think it is to make sure you understand your labs. Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner, and I'm joined today, as always, by the very debonair Dr. Jason Martin. He's a board-certified plastic and reconstructive surgeon. Dr. Martin, I see you have a mini-me.
Yes, I have a bobblehead that was given to me by one of my patients.
It's fantastic.
Maybe the apex of my career, as a plastic surgeon.
See, I knew this was coming, and I managed not to tell anybody in the office, and I didn't know that it was going to be so awesome. Like, I kind of thought it would be like your head, but just on like a generic body.
Right.
But it is literally you from head to toe.
It's me from head to toe.
Yep. Including the pose, even down to like the way your shirt collar is open and your pocket square.
I'm feeling like if there's meetings I don't want to go to, I'm going to send my bobblehead.
I think you should start doing this on telehealth appointments.
Yeah.
Just have your bobblehead sitting there.
This is going to be my avatar. So I really want to thank our patient that gave that to us. Who made this, Amy?
So the patient actually brought in the card from the gentleman who made it. His name is Jerry. And if you are looking to have a custom bobblehead made, you can email him at sale, S-A-L-E, at LaClay, L-A-C-L-A-Y, figurine, spelled out F-I-G-U-R-I-N-E.com.
You didn't mess that up. That's good.
Yeah. Well, sometimes every once in a
You're
while.
getting better. It's like practice makes perfect.
And he's also on Instagram at LaClay Figurine on Instagram.
Yeah, it must be French.
LaClay.
LaClay.
LaClay Figurine.
Yeah, it's awesome. I have to say, like, if you look at this thing, it's pretty detailed. So if you're looking for a very detailed bobblehead that looks somewhat or mostly like you, then this is it. This is awesome.
Remarkably detailed.
Yeah. I'm going to set this over here. So every time I put my hand on the table, it's still going to bob. It's going to bob it's going to bob to our voices.
That's awesome. So, Dr. Martin, we have a great topic today. We're actually talking about scar revisions. And if you are listening to this, you have to go on our Instagram or on our YouTube channel just so you can see the bobblehead doll. And you can find that at Jason Martin on YouTube, Jason Martin MD on YouTube. Without further ado, I think we should address something before we get into the scar revision.
What are we addressing, Amy?
Well, let's just take a look, shall we? Dr. Martin, do you have anything else to say?
No.
Oh, I do.
Yeah.
Big podcast news.
Okay.
This is huge. So we are remodeling our podcast studio.
Oh, this is so crazy.
This is the last time you'll see us like this. It's going to be totally different the next time you see us.
If we really cared about promoting this podcast, we'd put this all over Instagram and show the steps of the transformation.
Well, it hasn't started yet, so maybe we will.
We will not.
We might.
The next show will be different.
The next show will be different. So
it's going to be awesome.
Yeah, leave us some comments on our new backdrop when it happens. It'll be totally
Wouldn't that be
different.
funny if we don't do it, which is so us?
And it's just like this again.
The next show, and everyone like the real listeners are like, well, it's no different.
Like, what'd you change? Oh, it's subtle. Remember, we always talk about subtle differences are key.
Little lighting differences.
You can always
there.
do more. Yeah.
I moved the cup to the right just a little bit. Yeah.
Yeah.
Okay.
So we're going to be coming at you from this same room, but a redesigned studio. The next time you see us, hear us, worth checking us out on our YouTube channel so you can see the new stage, the new studio. So thank you everyone so much for listening, and we'll see you next time.
See you next time.
Yeah.
Yeah. I think the bobblehead was it.
Yeah. And I don't have my hair in a ponytail.
That's what. Yeah. Exactly.
I am wearing a
totally different. We got a bobblehead
jacket instead of a lab coat.
Yeah. So was it COVID or supply chain issues or inflation? What slowed us down?
I would say it was labor. Labor.
Mm-hmm.
Yeah. So we are still working on our studio redesign.
Next time it's going to be amazing. We're going to have Bengal tigers. It's going to be birds flying around. It's going to be the most amazing backdrop we've ever seen.
Yeah. So things are a little delayed just because it took us a little longer to come to like a meeting of the minds and then to get,
But is it on its way? Like, is it?
It is.
Okay.
It is more in the works than it was. Yeah. So it's coming. Yeah.
The worst thing you can do is build things up, and then
I was so
and then
confident.
it doesn't really come through. And I think we're kind of I think that we should have slipped it in. Like, oh, the backdrop's different. Now everyone's going to be like, oh my God, I can't wait for the 3 episodes from now or whatever.
It's going to be good when it's there. So, I mean, so you're seeing this, it's the middle of July, 2020, hopefully by the...
2020?
2022.
Okay.
Hopefully by the beginning of September.
Yeah.
Yeah. So we'll see. So it is coming. So we apologize for not having that done just yet, but still highly recommend checking us out on YouTube.
I mean, it's fine. We're not really feeling that bad about it.
No, so. It will be cool. I am excited about it.
I'm excited. Yeah. I think it's always good for change, but cool. You know, it's about your personality, Amy.
Yeah, that's
not the backdrop.
Yeah. So on to the podcast. We're talking about scar revisions, and as we typically start these podcasts that are talking about procedures, we talk about the statistics.
Never would have thought to talk about scar revisions.
Yeah, this was actually a recommendation from someone, and I was like, that's an excellent idea. Like, they asked, like, what does that mean? You know, they'd heard that term before and were really unsure about, like, what is a scar revision? Like, what does that mean? And I think it'll be good to talk about. And interestingly enough, when I pulled up the statistics from 2020, which is the last year we have statistical data from, I was like, oh, it's probably not going to be there. So I looked through, you know, all the cosmetic chart, and I'm like, oh, it's not there. Like, oh, yeah, it's not there. It's under reconstructive procedures.
Right.
So there is no delineation between cosmetic and reconstructive scar revisions, whereas on a lot of procedures there are differences, like breast aug being a primary one where there's a category for cosmetic and a category for reconstruction, primarily for breast cancer reconstruction, but on scar revision it's just scar revision. I was kind of surprised to see that the amount of change, I mean, we saw a lot of change obviously from 19 to 20, but the scar revision really stayed very static.
Right.
Didn't really change much at all, and hasn't really changed much since 2000.
Yeah, it's probably not going to, right? There's not a rush on scar revisions, but I think that scars are a commonality among people, traumatic or otherwise. You can have scars you don't like from cosmetic surgeries. You can have scars from injuries.
You're jumping all over my slides.
I got you. I always do that, and I don't care. I'm going to keep on doing it. You can have scars from many different things. So the reality of it is it's going to be a common procedure, and it's going to be a common procedure both in the cosmetic world and the reconstructive world.
Yeah, for a lot of different reasons. And we have a great podcast episode where we talk all about scars in general. And that would be a good podcast to listen to if you want more information about scar formation, because we'll talk briefly about it now, just kind of the steps of a scar. But to go really deep into this, we have an episode all about that.
Yeah, it's a really good scar
episode. It is. And I think it is important, though, to discuss what a scar is. And why do some people always ask this with surgery, like, will I have a scar? And like, I don't know how they think that it would be possible to have an incisional surgery without a scar.
I mentioned this before in the scar episode. You can do surgery on a fetus, and you know, at this time in our country, I don't want to talk about fetuses or anything with pregnancy, but if you can do surgery on a fetus, and technically in those cases when they these rare times they do like heart surgeries on the fetus, those scars, the baby will be born and there's not a scar that's evident. But those are because they still have these pluripotent stem cells floating around, and somehow everything just rebuilds and just disappears. But like for normal humans, you're going to always have a scar with an injury. It may be faint, it may be almost invisible, but it's going to be there. Yeah.
And a lot of that is just because I think people fixate so much. And the reason I have this slide up is because people really fixate on the surface of a scar, but that's not really where the scar is coming from. You know, we look at the skin and we see the scar on the surface, but no one ever asks, and never once has anyone ever asked me, like, will I have blood vessel damage? Never.
What's going to happen to my fat?
Right. Like, people just ask about the surface because that's what they see.
Is it going to be hurt?
Right. But obviously, if you're cutting...
I mean, there's scarring everywhere. I mean, like when you get liposuction, there's scarring underneath your skin everywhere you do liposuction.
Yeah. And if you are bleeding, you've cut through something that is bleeding, which means that that little vessel wall has been disrupted, which is actually what triggers, at least we think, and we still don't know this entirely, which is what makes the process of healing, wound healing, so amazing, is that we don't really fully understand even what's happening totally.
By the way, it's so complex. I talked about this before too. I had this trauma attending when I was in training. Do you remember me talking about this? That he would go to these like, really, it was really nascent at that time, early 2000, like AI conferences where they would do like big mathematical computations, and that's when AI was coming about with supercomputers. And the big part of the topic was wound healing because it's so complex.
Trying to get like supercomputers to figure it out.
They didn't really understand like the modeling of wound healing. And that was one of the things he was talking about. I distinctly remember being in the call room, like, you know, sleep deprived after not sleeping for 48 hours. And this guy, Gary On, what's his name? He was super smart. He just starts talking to me about modeling wound healing and with supercomputers. And I literally fell asleep.
Yeah, well, because it's complex.
So, but it is amazing. And I think this is, you know, these kind of things, these little details related to our our physiology is how we're going to make breakthroughs in healthcare, but even in cosmetic surgery. So, understanding the processes of wound healing can help you understand the processes of regeneration, of how to slow aging. I mean, these things all are in somewhat related to each other.
Oh, absolutely.
So, I think studying and understanding what's going on here is very important for everything that we deal with in healthcare.
Yeah. And I think it was in our episode on scarring where we talked about being a Sloverine, or in one of our episodes. Because really, I mean, when you think about it, like, it is amazing that the body just does this. And it's so complex that like supercomputers are trying to figure out what's happening, but it just does it. And like all the things that have to happen to make your body heal are really remarkable. Initially, when you cut yourself, if you have like a little very, very superficial cut that doesn't bleed, heals really fast and probably won't scar. And why is that? Well, it's because you're really only cutting through dead skin cells. So like if you get a little paper cut that does not bleed,
that's a good point.
It will not scar.
Yeah. You don't scar from every superficial injury.
No. So. Or like if you, I think acne blemishes are maybe a good one. Like you can have a pustule or something that breaks the surface. And as long as it's, small, it'll heal really quickly and you may not scar from that. Now people, if you keep attacking your skin and you have acne, you see those really deep pitted scarring. So you can scar, but you don't always scar. But what happens when you cut into the area where there's blood supply, your blood vessel itself, the lining, the endothelial lining starts to release these chemicals and hormones that flood the area. Initially, they constrict bleeding, right? Because like, oh my gosh, we're bleeding. We don't want to die.
Yeah, that's the platelets.
Yep.
That was actually our listener episode questions. She talked about neutrophils.
Yep.
And neutrophil deficiency, the platelets release all these factors that draws in macrophages and neutrophils. And neutrophils are a big part of that. And that goes into the stage where you attract in the fibroblast.
Yeah.
So I mean, that healing process is pretty definitive, and that's a cascade. And any part of that cascade can be disrupted by diabetes, by steroids, by drinking too much, right? By being in a low oxygen environment.
Yeah, by infection.
So it's crazy. And it's even crazier when you really start thinking about this in a micro way, that I do this for a living. And I just like kind of cross my fingers and hope everyone's bodies heal that well, and they do. It's like a miracle.
It kind of is.
It's kind of, when you actually think about it, we do all these things to people. And if you're technically good and you have a good plan, it turns out okay. So think about, now I'm starting to get a little weirded out.
It's pretty cool. Yeah.
I think I need to quit and go off into the sunset with my bobblehead. So
let's talk, we'll just go through the 4 stages here really quick. So homeostasis, initially, you
say homeostasis like you're from England. I know you had an English grandparent. Did they say homeostasis?
Maybe.
Okay.
How do you say it?
Well, because like the British say hemio, like they say we say hemostasis, and the British say hemio because they have HEMEO.
Hemostasis.
There you go.
So hemostasis, it's really hard to say it that way, is the first stage where your body is constricting blood flow, trying to prevent you from bleeding out, right? After that finishes and it realizes like, okay, good, we got this. We formed a big clot right there, essentially. We're not going to die. Then actually you get blood flow to the area, which causes redness, which can cause warmth. It causes inflammation. It's bringing in white blood cells, all the cytokines, the neutrophils, everything's coming in to make sure that the incision or the wound is clean and that it's got blood supply. So no blood, lots of blood. And then we get the remodeling, the fibroblasts, the elastin, like everything gets laid down to fix itself.
And we use the analogy of Lincoln Logs, and this is only for people over 40 because anyone under 40, straws that you throw on the ground. Fibroblasts come in and lay down all this collagen, or assist with the collagen, formation process, and it's all irregular. And then over time, the Lincoln Logs get organized, and that's where you get to the remodeling phase.
Yeah. So those 3 initial phases of a scar is up to a month. That's why when people like come in like a week after surgery, like, oh, this is still like not healed. I'm like, yeah, it's a long process.
Right. And scars get hypervascular. The hyperemia is present like at a high level at 4 weeks after surgery. It's 1 month. So people come in at 1 month. They're like, oh, my scar is red. I'm like, yeah, thank God it is.
Yes, it has blood supply.
That's what it's supposed to do. Like, this is a good thing. This is not a bad thing.
Yeah. And then the actual maturation of a scar is up to 2 years. And even then, we don't really know if that ever stops, right? Because you continue to change over cells all the time. The difference is the way a scar for the rest of your life does that cell turnover is forever changed. And that's why a scar persists. So if you have a really deep cut, I mean, I have one, I'm sure we all in this room have some really major injury. And at the time when it happened, I was about 12 years old, like cut down to the bone. And for a few years, like it was pretty grisly.
In the mountains, did you guys just bind that together with pine tar?
Yes. I found a random bear and no.
And wire that was on the farm?
No, but the same ER doctor who sutured up my dad and my brother all within the same 7-day period. So we got frequent flyer miles.
Because your stories from your childhood are like my wife. My wife's stories from her, if you listen to my wife's stories, she started working when she was 2, to make money.
To make money.
Yeah.
I didn't. I was running
your
in the
stories,
woods.
it was like, you don't know what it's like. Growing up in the mountains, I had nothing. I was down a dirt road.
I was. Mm-hmm. Dirt road, no street lights, but it was awesome. I'm not saying that's a bad thing. To me, that was like idyllic. I mean, it was amazing. I mean, yes, I did have to wait a while to get urgent care for my wound, but you know what? In the meantime, it had done all these things, so I wasn't bleeding out in the woods.
This goes back to the story of the bear injury.
Oh my God.
Like my first 2 months in Aspen, they called me from the ER and said that one of the employees got attacked by a bear. And I literally, in my mind, was like, I didn't think that was possible. Like,
you'd just gotten there.
Right. From a city.
So, and you were in Vail, driving through the fulminant snowstorm.
Oh, yeah. Barely getting there. So, yeah, I think when you live in rural areas, weird things happen. And sometimes you have to just make do with what you got. You got to MacGyver it.
Yeah. So if you want to hear more of the story of Dr. Martin with the bear, it's on our episode where we talk about Dr. Martin, which is an old one. It is on video. Yeah, you guys
surprised me. And I had a Henley on. I looked like a complete idiot.
Well, you were on trauma call.
That's what I hate, the internet, because it just preserves you looking like a dope.
You know what? I'm sure that 10 years from you now, we'll look back at that and be like, wow, I wish I could look like that again. Exactly. So never ever take that for granted. That lives.
That was a fun episode.
Can watch
you guys surprised me on that.
Yeah. So you can hear more about this bear attack if you go back and listen to that episode. So scars, go through these basic 4 steps: bleeding stops, inflammation, more blood, repair, and then maturation of the scar can take years.
Yeah.
Really we tell patients that their scar is still in that active phase for at least a year. And it can be up to 2 years where it's still very active. And then it kind of goes a little more dormant and starts to just kind of be more.
And I know you're going to get to this, but understanding how long it takes for a scar to mature, understanding this time frame is not within a month, is really important to the things I'm sure we're going to be talking about in this episode. Yeah. So it's empower yourself. Understand that wound healing is a lengthy process. A lot goes on in that first 3 weeks or 4 weeks. Mm-hmm. But then you have this 4th stage of remodeling that is months and months and could be years.
Yeah. And during that time, the strength, the tensile strength of the scar changes a lot. I mean, obviously that area is very weak in the beginning. By 7 days after an injury, it's 80% stronger than it was when it was initially injured, which is remarkable. How quickly that kind of lockdown happens on a scar or on a wound, but it really takes a long time to get back to normal from there.
Yeah, so you get this 80% in a week, and then it takes 6 to 12 months to get to...
Or 24 months.
Yeah, to get to full strength, and it's never full strength. It's 95% of what you were when you started.
Yeah, never quite the same.
You're not stronger when you get injured, but it's close to it.
Yeah, which again is so, it's
really
crazy. Is remarkable.
This is kind of a meta conversation, but just think about that. We regrow stuff on our skin or inside of our body when it gets injured, and somehow it almost just goes away and you barely see it.
Yeah, and and again, most people aren't thinking wow, my blood vessels were literally sliced. And those all heal just fine too.
You're kind of stuck in the blood vessels. There's nerves, there's fat, there's bone.
That's what all of that though. That's why when people
I think it's crazy that you fracture a long bone, you stick a cast on, and about a month you can walk on it.
Right, it fixes itself.
Yeah.
We really are Wolverine. Yes, it really is remarkable.
Or I was thinking about this the other day. People have TIAs, which are strokes, but this very limited. So they have these episodes, right, where they have loss of blood supply to a certain area of your brain. And then you lose functioning in your body, something happens, and then it goes away, and then you're fine again.
Right, because it reroutes. It's like a highway, your body just finds a back road.
I'm just what is going on?
All those little glia cells are oh my gosh, go over here, we found a bridge, guys.
And it is funny, it's so you'll talk to patients. So you think about that, even as a clinician, I know what's going on, but it's still amazing, right? Mm-hmm. The human body is amazing. And then you'll talk to a patient, and most patients oh, that was really scary, and you feel kind of the angst. But some people are yeah, I had TIA. Yeah. I couldn't move my arm for say half a day. Then it was better.
Right.
I'm on my way. And I'm doesn't that kind of gets you like in the inside, like make you think a little bit. And they're like, yeah, no.
Well, like Bell's palsy is a great example of that too. Like how you can literally have one side of your face be paralyzed randomly for like maybe weeks, and then it's just back again.
Right. And if you're a medical professional, clearly there's medical reasons why this occurs. We understand the physiology that's going on, the pathophysiology. But just the idea that we could be so abnormally affected and then somehow our body figures out how to heal itself is pretty crazy.
Yeah. And does it without you having to think about it. Can you imagine if your wound healing was dependent on you being like, okay, oh my gosh, body, like send out the neutrophils, like get some cytokines in there.
Man. That's all I would concentrate on. I wouldn't even go outside.
Like we need leukotrienes. Like, I mean, nobody would. Like you would never be able to make that happen. It just shows that our brain is an amazingly powerful supercomputer that can do that.
And so is our immune system too.
Yeah,
and this is a big part of this is the immune system. So
yeah, but dictated by the brain knowing what to do and when. And the fact that a lot of that happens like within the blood vessels themselves, that these things come from there. I mean, it really is remarkable. Right. I've talked about this way too long.
Right.
Scars, but this is important to know.
It's not just the brain, it's the central nervous system. I just want to make it real clear because people that gets confusing. But I know what you're saying.
It does, but I mean your brain is the one that's actually controlling all of that.
I get it. Okay.
And at the same time, you're not having to think about breathing, or your heart beating, like all of that still
everything
keeps
goes to your
happening.
brain, but the central nervous system is autonomous. Right. Gotcha.
Yeah. Yeah. Okay. So let's talk about what a scar revision is. So there's two types of scar revisions in our world. There's cosmetic or elective, right? So maybe somebody's fixing something from a surgery that they chose to have. And there's reconstructive. So Dr. Brown, why don't you talk about some like situations where each of those would be the case?
Well, cosmetic is pretty straightforward. I mean, I think anyone can imagine that. You do a cosmetic procedure and some part of your scar does not heal well. And that's not uncommon. Even in offices like ours that we do a really good job, people universally have good outcomes. You still might have a situation with a good outcome that someone needs a scar revision. That's because we push the envelope. We pull tummy tucks really tight because we want people to have the best results. We try really hard to put scars in interesting areas that are invaginated. All these things can have consequences during healing. They can get moist and macerated. With the tummy tucks, you can pull really hard and the body is just not happy with it with the healing process. So you may have to redo a part of the scar. People can have wound healing issues afterwards from infection, from inflammation.
Abrasion even.
We've had people that we've done surgery on and they put hot packs and didn't feel like that they were technically burning themselves, and they've had burns afterwards on the scar area. We've had cold injuries. So there's so many different things that can occur with cosmetic surgery, even when you have a good surgery. The other avenue is that you don't have good surgery and you come in that you not only do you not have a good outcome, but your scars really look janky and bad. And we get those kind of people too. And unfortunately on a regular basis, probably.
Yeah, like the placement of the scar is not ideal. And sometimes you can't fix that.
But. Yeah, I mean, being in the office like ours, we're the fixer people, and I hate to even say this externally because it just gets so overwhelming. You can't just fix everything. So, those are the two avenues that people come in, but like scar revisions and cosmetic surgery are not uncommon. So if you're listening to this episode or watching and you're like frustrated you had a scar revision, you're not alone. I mean, even in the very capable office, I'm sure it's 10 to 20% of all cases. And maybe I'm overestimating that, but I want to put it in scope that this is say it's 20%. That may be too high.
I'd say that's pretty high.
All right, whatever. This is for argument's sake, a fifth, right? So maybe they'll need some little touch up here or there. Maybe it's very small. It's not a full on scar revision that you're doing. You have to go back to the operating room, but scar revisions are not uncommon in cosmetic surgery. Reconstructive surgery, I think scar revisions are a lot more common. You can have reconstruction for trauma. So a trauma is not taking as we said in the listener question episode about the samurai sword, right? You're not getting a ninja when you get traumatized to hit you with the samurai sword perfectly so you can put it back together. You're falling down and hitting your face. You're hitting your arm. You
bitten by a dog.
Yeah, all those kind of things. Those are very aggressive injuries that are not done skillfully like with an operative knife or a samurai sword. So, and in those situations, they tend to not heal as well, even if you reapproximate it and do it. And that's because the tissues are crushed. They get so destroyed. You're very injured. Yeah. Your body is injured. You have a lot of very high inflammation. Your body is stressed. In reconstruction, you can see this all the time. Even in controlled settings like breast cancer reconstruction, facial reconstruction from a Mohs procedure. Again, it's the same idea. It's not like an elective surgery.
Well, and there could be other, especially with breast reconstruction, mitigating factors like radiation. All of those things that disrupt your body's ability to heal, medications that you're taking.
Right. chemotherapy.
Yeah.
So reconstructive surgery, I think scar revisions are more common. So maybe that's the 10 to 20%. Maybe that's where we're looking at that. Maybe cosmetic surgery is 5 to 10%. But whatever the case, I don't think that anyone with, at least with injury or some sort of medical problem that requires surgery versus cosmetic, you need to know that there is always a risk that a scar will form that needs to be addressed surgically. Now, in most cases, even on the reconstructive side, you can do most of these scar revisions in the office under local anesthesia. You don't have to go to the operating room. Now, it's not 100%, but it's more common that you can do that in the office. And that tends to make people feel better, that they can address some of these issues without having to go through the rigmarole of going to a hospital or a surgery center. So,
yeah. I mean, and really what a scar revision is revising an area that has a scar. So whatever the reason really, and we've explained a lot of them, whether it was an elective surgery that left you with a scar, whether it was a bicycle accident that left you with a scar revision is revising a scar that is there.
Right.
So you have a scar, we're going to make it better. So let's take a quick break before we get into some of the meatier details about scar revisions.
While we take a break, I'm going to talk to my bobblehead, if that's okay with you guys.
I mean, I do. How
you doing, buddy?
If I sit in your office when you're not here, it is kind of like comforting.
Yeah, it is. I don't need a therapist. I got my bobblehead.
I don't even know if we need you to come into clinic anymore.
I really don't.
I could just put it in my pocket.
Yeah, we could. And we could just put a little speaker on the back, and I could be sitting at home like the Big Lebowski with my... All right, let's go. I think we're going to get checked. Let's get checked. Okay.
Dr. Martin, I'm super excited to talk about our sponsor for this podcast, Let's Get Checked. If you've been a listener of our podcast, you know that we have never had a sponsor before, and that's because we're an educational podcast. We're not looking to monetize, and we also would never recommend something that we didn't believe in and or use ourselves.
So basically you're saying we're very choosy.
We're very choosy when we come to our testing, but Let's Get Checked really aligns with our values. We talk a lot about monitoring your blood values of certain things. We talked recently about vitamin D serum levels. We talk a lot about hormone levels, and it's hard for some people to get to a lab, or you're afraid of the blood draw, or just, you're concerned about confidentiality. Like you have a lot of concerns and you just don't do it. Let's Get Checked makes it super easy because it's completely confidential. You do it from your home. So there's really no excuse not to do it.
Yeah, and we did it recently. Both Amy and I did it. She looked at her women's health, basically her hormone levels, and I looked at mine on the men's health side with testosterone. It was very simple. You go online. Their online interface is really easy to use and good. We got the testing kit very quickly. And the test itself, actually doing the stick, you do a stick on the end of your finger, is not hard to do. It only took about 3 to 4 minutes. You put it back in a sealed envelope that's confidential, goes back to them. You get your results in 2 to 5 days. It's really that simple. And the best part is it's about empowerment, about you taking control and trying to do things that are positive for your health and life. And this is one way to do it, literally from the comfort of your own home.
Yeah, so they offer a wide range of tests. So they do men's and women's hormone panels. They do a full panel of STD testing. They also are now offering a COVID-19 test at home. So there are a lot of other just basic blood levels that you can get tested as well. And one of the things that we always say is you can't track what you don't check. So you might not know what's normal for you in the future if you're not checking it now, especially as it relates to hormones. And men's health specifically, I feel like is a little bit undertreated. I mean, sperm counts are dropping by a large percentage in men these days. Most men struggle at some point in their lifetime with low testosterone.
And those men do not know what the symptoms of low testosterone are. Depression, anxiety, sleep problems, osteopenia or loss of bone, loss of muscle, and something we treat all the time, gynecomastia or male breast growth. These are real problems that can be improved or treated with testosterone. And these men do not know their levels. It's so easy to get checked. And this is why we're so excited about the sponsor.
Yeah. And Let's Get Checked is a completely CLIA certified lab, the CLIA lab. So they're a well-established, completely safe lab to use. You do get contacted after, so you get your results. I got a text at 4:30 in the morning, which I loved, that my results were ready.
And we're both up at 4:30, so that was good.
Super excited. And you have access to not only a nurse, but also a physician. So a physician does review your results, and it gives you a little breakdown of like where you're sitting on those levels. Dr. Martin's had even comparisons of like where 2 of the levels should be in relation to each other, which is a really important thing to note.
Right.
Just being within the normal range is not always enough. So it really gave more information than that. You'd still want to, of course, reach out to your own doctor if you needed some additional assistance with these labs or you did see something that was concerning. We didn't, thankfully, so that was good.
Yeah. We were both good. This podcast is about empowerment. It's educational. In my private practice, I'm a board certified plastic surgeon. We are all about empowerment, and this is one way to do it. So we're very excited about the sponsorship, and we're looking forward to using it for our patients moving forward.
Yeah. So as a listener of our podcast, if you're also a new time user to Let's Get Checked, which a lot of you probably are, we do have a 20% discount code. So you do need to go to our specific URL, and it is linked in the description box below, but it's going to be TryLGC. So TRYLGC, like Let's Get Checked.com/beauty, BEAUTY. And you'll need to use the code BEAUTY20 at checkout. Beauty again is BEAUTY 220. And you can pick a test, like any test you'd like, put in our code and get your test shipped to you. Getting tested is the right thing to do. It's lets you know where you're at and what's responsible.
All right. Well, let's get tested.
Let's get tested. Let's get checked.
Let's get checked.
And we're back. All right. So let's talk about why someone would want or need a scar revision. Like
You're always so good at this stuff because I never would have kind of set it up this way, and I think this is way better.
Okay. So there are
because I would totally be stuck on the injuries and why scars occur, but it's really about why would you. The topic is scar revision. Like, why would you need one?
Right, or want one? Yeah. I think probably one of the biggest ones is previous injury. I put childhood injury, but really any injury. And a lot of times I put childhood injury specifically because a lot of times if you injure yourself as a minor or as a child, you don't want to go back in on that scar right away because you want to see how the rest of the body grows, right? I mean, it may be huge, right? We see this a lot with little kids who have dog bites, unfortunately. They usually bite right in their face. Well, the scar that is huge on your 2-year-old may look fine on an 18-year-old. So you want to give that scar a chance to develop to its full maturity, but then also the person to develop to its full maturity.
Right. Abstract thinking develops around 7 years of age. So before that, you can probably just do surgery on a scar and just make it better, and the child maybe wouldn't fully understand what's going on. But after 7, you're doing surgery on a scar that looks abnormal in the scar. That may cause some detrimental effects from a mental standpoint, psychiatric standpoint. So it's really good to wait in most cases, if you can, if it's not so distorting, till someone is of adult age, they can make really reasoned decisions and understand a little bit more about who they are and what they want.
Yeah, and if it's even necessary.
And if it's necessary, and a lot of times it's not. We get very helicopter moms in here. God bless these
and
people.
Dads.
Yeah, and dads. And there's nothing wrong with them. I mean, I get it. But they're like, oh, this terrible scar. And you look at their child and it's like barely evident. And the child, say they're a teenager, like, I don't even know. Like, it's fine with me. And categorically, I tell those parents, like, just wait. And they don't like that answer. They probably go somewhere else. But I think you should wait. I think you should wait till someone is of adult age. Then once you become an adult age, then it's really their prerogative. You can do this selectively as long as there is a reason for the scar revision. I don't think that you shouldn't offer it to them.
Yeah. Yeah. Reason number 2, keloid or hypertrophic scarring. And those are things we talk a lot about in our podcast about scars. But keloid, a lot of people come and say like, oh, I keloid. Then I'm like, show me. And what they show me is maybe a mildly hypertrophic scar. People who keloid scar, a keloid is actually a scar that continues to grow. So it grows abnormally and it grows out. So it grows above the surface of the skin.
And outside the boundary of the scar itself.
Yeah. So it's thick, it's raised.
It's a fungating mass.
Mm-hmm. And not just slightly raised, like it can become painful, like it can impede motion. Like if you have one near a joint, like it can actually impede your range of motion. Keloids can kind of happen spontaneously. You can keloid immediately after injury. You can kind of start to keloid as within that first 2 years as the scar is changing. Like it can happen a long way out from injury. People who keloid typically tend to know that they keloid. It's more common in people who have a little more pigment to their skin. Tend to keloid more.
Yeah.
But the keloid is not about the color of the scar. It's about the way the scar behaves. Hypertrophic scarring is more about the color of the scar.
Yeah, and sometimes it's thicker. I mean, I would call it, it could be red or white, but a little bit thicker too, ropey in appearance.
Yeah, but really more like it's almost flush with the skin in most cases. It might be slightly raised, but it's...
Most scars that are abnormal looking are hypertrophic. They're not keloid. Yeah. Keloid is, it's not rare, but it's less common, a lot less common.
Pretty rare. Yeah, but scarring that's hypertrophic, you can kind of see that there are some things you can do to kind of help a hypertrophic scar look better. If you kind of see that starting within the first, few months. What am I saying? Hypertrophic, Ron?
No.
You just had a weird grin on your face like you were going to make fun of what I was saying.
Your pronunciations cracked me up. I mean.
Hypertrophic?
No, it was fine.
Oh, okay.
It's just like when you speak sometimes, and you're so eloquent when you speak, and you pick words so well, and also you're so knowledgeable. Like I actually enjoy listening to you.
Oh, thank you.
on this topic, and I'm a board certified plastic surgeon.
Yes, you are.
What do we call me? Debonair? I
Debonair.
have a bobblehead, and I like listening to. But it's just this like it's almost like the kryptonite for Superman. When it comes to pronunciation, like you get weird stuff coming in, like homeostasis.
Tell me how to say toilet.
No one in America. See, that's rude. That's rude. I come from Kentucky. You cannot. Yeah. I'm proud of my heritage.
On your toilet?
Yeah. So I just did it. We were in Kentucky visiting my parents for July 4th. I can say that, right? Because it's 4th. Okay.
After the 4th.
So you never know. I didn't know if we were still in makeup time. So I said toilet. I said toilet. There's an R in there somewhere when you're born in Kentucky. And my kids were like, what did you just say? They're like, whatever, dude. Like,
see, we've all got our weird vernaculars.
yeah, but you grew up in Colorado. You did not grow up in England.
No, I did not.
And no one ever said homeostasis. That is weird.
Okay.
Okay. Let's get back to
Okay. So there are things you can do, and we talk a lot about these in our episode about scarring, to kind of help a scar be better in those first 2 years. If you're past that point of the first couple of years of scarring, like, yeah, there are things you can try, but if you've really got a scar that has keloided or is hypertrophic at that point, a scar revision is probably a good option, or at least something worth investigating. Even a hypertrophic scar that is not keloided can cause issues, again, with range of motion. They can be painful. They can be itchy.
Mm-hmm. Especially on the joint.
Mm-hmm. A lot of things that people don't like about their scars, like they can just feel really weird. So fine-tuning surgical results, that's what Dr. Martin was alluding to when he talked about the cosmetic reasons for wanting a scar revision. And that's why I call that fine-tuning. Usually it's like maybe extending a scar a little bit, like to get a little bit of extra skin.
Right.
Fixing a scar that didn't heal perfectly, dealing with an area that may have had a slight infection.
Those tend to be a little more positive because the people are like, yeah, I'd like to make this even better, that kind of thing. But
yeah, or like, this is a little not what I expected. Like, okay, we can fix that. So fine tuning. Painful or impaired mobility, I talked about that earlier. Those are definitely reasons why people seek out scar revision, especially for traumatic injury scars, that are irritating or painful, or have built up scar tissue, like intraorally too. We have patients who've had like through and through injuries on their mouth or jawline that build up scar tissue that makes them bite it. We've had a few patients come in because they continually bite their scar because it's inside their mouth, and those things can be fixed. So
I've seen this in many different ways with breast cancer reconstruction when they move their arms and they have these tethering cords that attach to their scars. Everything. Yeah. So, and that sensation of tightness and discomfort and pain is really disconcerting. Mm-hmm. It can affect your quality of life. And so those are great patients actually for scar revisions. They get a lot of positive effects from the surgery.
Yeah. So a lot of reasons why someone would want a scar revision. I think probably the most common thing, though, that leads you to ask, and especially with reconstruction, is, won't it just do that again? Mm. And people say that all the time, like, well, this scar looks, they think their scar looks terrible, but they don't want to touch it because, oh gosh, it'll just look that bad again. But there's two key things that I think differentiate a scar revision from the initial repair. And those to me are the depth and the tension of the repair. So I think your samurai sword or your dagger is a good one, right? So you have a traumatic injury that is just, it's deep, it's going through a lot of layers.
Yeah, but you remember the samurai sword is done from a ninja that has skills.
Who skillfully does it. Either way.
Like the Ronco knife guy,
Right. You're having to go deep, like you're repairing from the bottom up. You're doing a lot of deep repair. There may be a lot of tension
especially
on
with
incision.
Trauma. Yeah. Traumatic scars tend to do really well with scar revisions because the mechanism for the scar revision and also the milieu or the environment is totally different than what you went through during the original healing. Yeah,
it's controlled, it's clean. We see a lot of patients who come for scar revision after, I go back to the bike incident only because bike accidents tend to be kind of dirty, right? Because you usually fall on, even if you fall on pavement, like it's pretty gross, or you slip and fall in the dirt, and that might be repaired by an ER doctor, and they literally are just like, they're getting as clean as they can, but there's just debris and dirt in there, So it's kind of a chaotic healing, So yeah, they sutured it up, but it's kind of gross. And then that leads into surgical repair versus traumatic injury. So when you're having it repaired surgically versus when it was repaired traumatically, obviously very different things going on in the body. And I think the biggest thing, especially for cosmetic repairs, is that we're going a lot more superficial. So if we're revising a portion of your tummy tuck, so when we do the tummy tuck, we're literally elevating a flap of skin and repairing the muscles underneath. Like it is all the way to the muscle wall, like down to the fascia.
Right.
Whereas we're doing a scar revision, we're just going through those first few layers of scar, and that's it.
And that makes a much easier time to heal. Mm-hmm. You heal quicker. It looks better quicker. And like long term, you won't have this delayed long term healing process. Like within a couple months, you're going to feel like it looks a lot better.
There's so much less to heal. And if you go back to that first picture, you kind of see like that how deep into those layers your injury goes or your wound goes. There's all of that has to heal too. So it goes back to what I said, when people just see the skin, they don't think about like, wow, there's a lot of stuff under there. Lymph, like lymph nodes, like everything that gets kind of busted up. And I think that's probably a lot with your breast cancer patients too. How do you, when you have something that's super tethered though, I mean, it's easy to repair a straight incision. So when you have somebody whose scar tissue is really tethering movement, like what do you do to
It's physical therapy
off?
And also the scar revision. So physical therapy is a big part of people that have decreased range of motion from surgery. And that's imperative. And you have to do the physical therapy beforehand, not afterwards.
Yeah.
So,
and scar massage, I think that's one of the fallacies you hear people say, like, I'm going to break up scar tissue. Like, well, you really don't want to do that because that's what's keeping your wound closed.
right.
But massage is something that is going to help your scar behave.
Right.
You know, so treating your scar better than you treated it the first time is also going to help.
Yeah.
So I think I'm pretty sure I have a slide about that. Yes. See, now I'm jumping all over my own slides about what you can do to make your scars better. But really, when you get down to the base of it, why will it not do this again? Well, it could, especially people who keloid. If you cut out a scar on somebody who keloids, they could absolutely keloid again. But when you're repairing something that was maybe traumatic or hypertrophic, like your chances of having that happen again are far reduced.
Right.
Just because of the controlled environment of a scar revision.
Got it.
Got anything else on that one?
No.
No? Okay. So who's a candidate?
Any breathing organism that has a scar and no health problems? Is that what we're getting at?
Yeah, people with scars that are healthy enough to have, surgery. I mean, if you're taking Plavix or blood thinners or something else that makes you unhealthy for any type of incision, you would not be a
Uncontrolled
candidate.
Diabetes. That's the same thing we say all the time.
High blood pressure.
High blood pressure. You're on chronic steroids, and especially at higher doses because you have autoimmune disease.
Recently finished radiation.
Someone with a history of Ehrlos, Danlos, and healing problems. I mean, it could even be further if the scar is over an implant. The implants, if the skin is thin there, you might not want to do the scar revision because you could cause problems with the implant underneath. The other thing is, people that come in with scars and have pain, I tell them categorically just doing the scar revision may not solve their pain problem. Yep. And when you tell them that, sometimes they're like, well, I don't want to deal with the scar right now. So you can send them to a pain doctor and they could do injections for the pain. And that sometimes solves the problem. So
acupuncture. Yeah.
I mean, there's definitely preclusions to having scar revision, but most people, if you're healthy and you have a scar you don't like, it's going to be amenable to a scar revision.
Yeah. And enough time has passed. I think that's the panic that people sometimes get, like, oh, like, I don't like the way this looks right now. Well, you're like, well, your scar is only 12 weeks old. And in their mind, that's
we get
like
those emails
forever.
all the time, by the way.
Yeah.
On our website. They're like, I had surgery like 3 weeks ago.
And I don't like my scars.
I don't like my scar. Can you help us fix this? And you feel for those people, but like, yeah, no, you're not doing anything for at least 6 months.
At least. And really, I mean, unless there's something very obvious with your scar, waiting up to a year is probably better because it gives that scar a chance to completely finish its initial remodeling. Right. The inflammatory factors of it may seem like forever. Like you look at it on the surface and it looks fine, but just remember there's a lot going on under the surface that is also having to recover from your wound or surgery. So downtime and recovery. This is then the next question. Like, well, how long am I going to be out for? When can I swim? Your favorite question, Dr. Martin, when can I swim? I've been asked that twice just this week.
If there's anything I talk to my bobblehead about is about your incessant swimming comments.
People like to swim. It's summer. So downtime and recovery is typically far less than it was from your initial surgery.
I have access to pools. Like I'm blessed. I can go to a pool if I want to. I belong to a gym that has a pool, and I really don't.
I actually wish my gym had a pool. The gym I go to right now doesn't, and I do sometimes wish it did.
Yeah,
kind of a water baby.
I don't feel. I mean, I don't mind swimming. I like to swim. I don't get it. I've never heard someone talk about swimming more than you, and you claim that there's this whole hidden population of people. Is there like a Facebook group that you go on for this? Like, where are these people coming from?
They're texting
No
me
patient
directly.
asks me about swimming.
It's because they ask me.
Something is up here.
Yeah, people ask me a lot of questions, and a lot of them are about swimming. When can they swim?
Yeah.
I'm going on a trip. I'm going to go scuba dive. I love to wakeboard. Yeah. I love to take long baths.
Okay.
Yeah. So yeah, downtime recovery is obviously going to depend on the extent of your scar revision, but it is a more superficial, in most cases, wound. So the downtime recovery is going to be less than it was from your initial, but you'll still, for most scars, most of our scar revisions are closed entirely internally, which does speed the recovery. But you're definitely going to have at least a couple of weeks where you need to be cautious of that area, not do intense exercise or anything that could pull and or disrupt that area of healing. I think that's important to kind of think about. Like, yes, you would need some amount of time to recover. Little bit of downtime. Could have bruising.
I just can't even have this conversation with you.
But some of the risks associated with the scar revision are going to be the same thing there. We talk about this with any surgery. I mean, you're having any type of procedure done, risk of infection, risk of bleeding, bruising, pain.
If you're going to go out of your way, and especially if you have to pay money and have a scar revision, you're going to take care of it just like a normal surgery. You're going to take 3 to 4 weeks off from like really doing aggressive working out and stuff like that. So you have to plan a scar revision correctly. You don't want to do it like if you love summer and you love to be active in the summer, you don't want to do it in the middle of the summer when you have to do stuff.
Well, that's one thing we didn't bring up is about things that maybe I never blame a patient for how their scar healed, but there are definitely things that you can do to prevent your scar from getting bad again.
Sun exposure being
key, and that's with timing. Like Dr. Martin said, you want to time it appropriately where you have the time to recover. You're going to be out of the sun, ideally for some amount of time, because when your scar is healing, that complicated process, if you're getting direct radiation from the sun at the surface, your body's primary goal switches from healing the scar to protecting your skin. So it can't do both. I mean, it's doing both things at once, but it's doing one preferentially.
Yeah, and those UVA and B rays are just irradiating the stuff that's going on inside those cells, which is like DNA turnover, causing dysregulation, and then you're not going to heal as well. Yeah. And that's why keeping it covered is like super important. I mean, we tell people just put Band-Aids on it if it's on your face, something that's impenetrable to the sun.
Yeah, like a physical block.
Yeah, or like a zinc-based sunscreen, but even that you have to apply every hour and a half to 2 hours, and no one does. So
my favorite is, well, I'm wearing a swimsuit. Like, no, you need to have sunscreen on under your swimsuit.
Yeah, that's always a funny conversation when you're having that.
Yeah, well, I'm wearing a swimsuit. Like, not enough.
It doesn't work.
Enough. Yeah, so you really want to make sure you.
I mean, I totally get that like mindset because I do that. I'm like, I'm wearing a t-shirt. Well, this t-shirt's worthless. You know, like these rays are going right through it.
This cotton is protecting me.
I know. And what was it, like 5 years ago or 10 years ago that's where those shirts became more popularized that have some sort of UVA and B protection quality to them.
Yeah, they help reflect the rays off
of
you.
But
helps.
I wonder how good they are. I mean, I'm sure they're pretty good.
They're better than not.
Yeah, they're better than not.
Yeah. Yeah. So making sure you time your scar revision, that you have the time to have your downtime and recovery, but that you also take the steps to take care of your scar. Really, more than anything, is listening to your doctor's instructions. I mean, I think that's where you see the biggest issues with wound healing is people who are maybe not following instructions. Yeah. They maybe do something that is too soon after their surgery that might cause some separation of their wound. So making sure that you're following your doctor's instructions on how to take care of your scar, very important. Keeping it out of the sun, doing the right things, being healthy, being ready for surgery. Yeah,
and sometimes, like especially with cosmetic surgery, say you do a medial thigh lift, inner thigh lift, and you get a little dehiscence of the wound, which is not uncommon, and that heals by secondary intention. A lot of times it heals amazingly well, but sometimes that scar's a little thicker. So if you need a scar revision there, that afterwards you're going to have to do your part to avoid that dehiscence again, or the splitting of the wound. And that's what Amy's talking about. There's a responsibility on your part. Amy and I, again, are not like most offices that sit there and blame the patients for everything that goes wrong. But I think
patients blame themselves. They're like, oh my gosh, I did this. I think this is what did it. And I'm like, that absolutely did not do this.
I know. But
like did not.
They do have a response. You do have a responsibility. You have to take responsibility for your recovery in these procedures.
Yeah. All right. I think that covers it.
That's pretty good.
We know what a scar revision is. We know who's a candidate. Yeah.
Yeah, it's so funny with these episodes. I never would have thought to do this episode. This was very informative. I'm sure people are going to watch this and get good information from that. And if you have questions, just email Amy. She's actually a perfect person to talk to about this. Scar
revisions are great. Don't feel bad if you need one. Seek one out if you think you need one.
Yeah.
Yeah. Find a good board-certified plastic surgeon.
Right?
Yes.
Or board-certified somebody that does surgery. That's probably,
somebody that does surgery. Yeah. Well, I don't know. I may not go back to the guy who did my appendectomy to fix the scar, or to my orthopedic surgeon to fix the scar.
Or your obstetrics doctor for your
right. Oh yeah, definitely
the C-section
not.
Scars.
Yeah,
that like universally look terrible.
Yeah,
I feel like there was like in the 80s some kickback from the plastic surgeons to the OBGYNs just to say, look, just make all the C-section scars terrible, right, so we can all have business in perpetuity, and like that's carried on.
Oh, I mean, think about the circumstances under which you're having a C-section. Your skin has been stretched to the max.
I know. Like, we gotta. Yeah, I got you.
Yeah, there's so much going on.
Yeah,
there.
it's hard to make that look great at that time.
I would think even a plastic surgeon would struggle to maybe understand how that's going to look in a year just because of the factors of the patient.
And like, you know, for an OBGYN, their primary responsibility is the child.
And the mother.
The child.
Not dying.
Yeah, to get the child out, breathing, and then save the mother if necessary.
Right, let's not let the mom bleed out.
Yeah, again.
Put her uterus back in.
Going into bad conversations again. This is
like, oh, look, we have a newborn and we have a uterus.
Plastic surgery podcast.
Yeah.
So, thank God.
Stuff the uterus back through this hole.
Here we go.
Take the bladder sling off.
Oh,
yeah,
no.
There's a lot going on with C-section. All right. With all that said, scar revisions are great. Thank you, everyone, for listening. If you would like to leave us a comment, we would love it. A rating, a review, it really does help us out and helps people find us. The algorithms are such that they like interaction. So interact with us. We'd love it.
Yeah, we love it.
You can also leave us a voicemail at 303-630-9038. You can also text that number. We got a voicemail. So if you listen to our first episode of listener questions from earlier in this year, we had a lovely patient named Faith. She did get back to us with her preference for sports, which I thought was awesome.
What was it?
Oh, we'll have to. We'll play it. I'll play it for you.
Was she a Duke or North Carolina fan? Either one sucks, but like, that's the question.
Right. So we do listen. Right.
I mean, screw the scar stuff. Let's see what's going on in Faith's life.
Are you gonna roll Tide?
She'll be an Alabama fan in college football. She'll be like a Golden State fan in like NBA. Right. She'll like all the best teams. That's the worst. Like, I like people that like teams that are terrible. Like, that's why I'm a Cubs fan. Like, I don't think anything's ever going to happen with that team.
My Cowboys fan.
Yeah.
So we do listen. We love your voicemails. We love your comments. We really do appreciate everyone listening. And without further ado, see you here next time.
See you later. Bobblehead says goodbye.
Don't forget to check out our sponsor, Let's Get Checked. Let's Get Checked offers fast, affordable, and completely confidential health testing for everything from STDs, male and female hormones, and even COVID-19, right from the comfort of your own home. And remember, new customers and listeners of our podcast get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com/beauty and use the code BEAUTY20, beauty, BEATUY 20 at checkout. Get checked. It's the right thing to do.